and welcome to Health Live at Seniors Today. It's a bright and very hot Saturday evening here, and but we are delighted to have a very senior doctor with us, who is going to be talking about preventive gynecological healthcare for seniors. I have here in our midst Dr. Rekha Ambegaokar. I'll introduce Dr. Ambegaokar first. She is a very senior and renowned obstetrician and gynecologist with over 40 years of experience. Dr. Ambegaokar is devoted to safe motherhood practices, having contributed significantly to women's health and well-being. She established private nursing homes in Santacruz West in Mumbai, conducting more than 12,000 deliveries in the last 3 decades. Dr. Ambegaokar advocates for the art and skill of vaginal surgery while welcoming advances in robotic and laparoscopic surgeries. She emphasizes compassionate and ethical patient care and quality healthcare for all sectors of society. Dr. Ambegaokar was until recently with the Surya Hospital, and now she is Director and Head of Obstetrics and Academics at the Nanavati Max Super Specialty Hospital in Mumbai. An MBBS from the TN Medical College in Mumbai. She has done an MD in Obstetrics and Gynaecology from the Nair Hospital. An award-winning doctor, she is also a member of leading professional and community organizations. Welcome to Health Live at Seniors Today. How are you, Doctor?
I'm good. Good evening, everyone. Very happy to be with all of you today.
Thank you very much for being here. Dr. Ambegaokar, tell me something is how, post-COVID, there was a bit of a scare with all types of patients. How's it now? Is everything clear in hospitals?
Yes, I think we are all now immune to the fears of COVID, if not the disease.
Yeah.
And at least medical and our professional lives are back to normal. Patients are coming to the hospital without getting scared. We have stopped doing routine COVID tests. And there was a lacunae in health checkups for at least 2 to 3 years because of COVID, right from 2020 to almost the end of 22. Patients didn't step into hospital unless it was a dire emergency, which was really very bad because it stopped us from diagnosing a lot of diseases in the infantile stage. But now we are back to normal, I'm happy to say. Yeah.
And this is the summer, and the summers were when COVID got really scary. So I guess it's, and that's why the question to figure what are infection levels this summer of 24?
No, I think we're hardly testing for COVID. And at the moment, we're just treating it as a normal viral infection. And we are not seeing the morbidity and mortality which happened in the earlier years. So we're good. Let's not talk about COVID. We're going to forget about
it. Yeah, but at the same time, it was such a major thing which happened.
Definitely, it impacted all of us. I must say that our series of health webinars, and we've had around 200 doctors so far, emerged at the COVID period when there was a lockdown, and where a lot of senior citizens felt, this was in June of 2020, where a lot of senior citizens felt that there was no information coming in, or they wanted authentic information. So, which is why we decided to network, doctors and senior citizens. And in fact, I think for doctors, COVID brought in the era of video consultation to a big extent in our country, which till now was lacking. Our patients always felt that it's important to physically meet the doctor. And in COVID, I think we took that step forward into video consultation, the way these webinars work. So that was one of the, byproducts of COVID.
And you would be happy to note, and we generally entertain questions only from senior citizens here, and many of them, and they are there from across the country. They are very active on Zoom. They wait for the links. They are connected. They ask questions. So technology, etc. is, and the impression that seniors are not really into technology is perhaps just a myth.
It's a myth.
Absolutely. Great, Doctor. So I would request you to make your presentation, and to all of you here, as Doctor is getting the presentation ready, those of you who have questions, please put them in the Q&A tab, and we will address this to the doctor after she is done with the presentation.
Good evening and a hello to all of you. I'm Dr. Rekha Ambegaokar, and I'm the senior obstetrician and gynecologist at Nanavati Max Super Specialty Hospital, Mumbai. And my topic for the day is preventive gynecological healthcare for seniors. By 60 years of age, when the distressing symptoms of menopause settle down, many women assume that the role of a gynaec in their life is over. So most women meet a gynaec when they are young, when they're in their 20s, maybe for contraceptive advice, maybe for infections. Then they go on to their reproductive years when they meet a gynaec for labor, delivery, sometimes for infertility. Then come the years of perimenopause and with all its ramifications. And finally, by 60, once they have crossed into the post-menopause phase, they think that, oh, chalo, that's really good. Now I no longer need to go to my gynaec. However, that is not true. So why is preventive gynecological healthcare in senior citizens important today? So it has been estimated that by 2023, 7.1% of the population will be aged 60 and above. And with this increase in longevity, it has become very essential to define healthcare services for this group. What are the common reasons to visit your gynaec? The first is prolapse. Many women in the older age group come to their gynaec with the symptom that they feel that something is coming out of their vagina, which are typically the symptoms of prolapse. A few come with urinary symptoms, either increased frequency of urination or distressing symptoms of leakage of urine or incontinence. The very important reason to visit your gynaec at this age is for screening for genital malignancies or cancers, especially cancers of the breast, uterus, cervix, ovaries, and the external genitalia, the vulva and the vagina. And of course, we have the issue of sexual dysfunction, for which you may need to visit your gynaec. So what are the warning symptoms at this age? First, as I said, is the feeling of something coming out per vaginum. So whenever the woman strains in the washroom, either to pass urine or stool, she feels that there is some foreign body in her vagina, or she sees something, a bulge coming out of the vagina. Secondly, leakage of urine. Third, and very important, is at this age, if she has some unexplained bleeding from the vagina, if she has unusual bloating, abdominal back pain, or pressure in the pelvis, if there's a change in urinary frequency or severe constipation, if she feels there's a lump in the breast, or if she feels that the vulva or the external genitalia has changed in appearance. Now, what are screening tests? These are tests which are aimed at detecting a disease before the symptoms develop, so that complete cure is possible. And luckily for us in our armamentarium, we have two classic examples of a good screening program. That is the pap smear for cervical cancer and a mammography for breast cancer. Now, what are the frequency of these gynecological screening tests? Lifelong, a woman should try to visit her gynecologist once a year for a pelvic and breast examination. She should get a mammography done every 2 years till 75 years of age. She should do a pap smear every 3 years till 65 years of age, at which point she can stop doing the pap smear, provided at least her last 3 results were negative. And finally is pelvic sonography. This is important because unfortunately, this is the only method to screen for ovarian tumors. Now, what are the supplements in this age group? While a balanced diet is the best, it may not be sufficient at this age because of poor appetite, poor absorption, chronic diseases or medications, the common one being use of antacids which are taken for acidity. Hence, it is important to take supplements to improve bone health, nerve health, muscle mass, immunity, and hemoglobin. So what is the take-home message here? It is very important for women not to feel embarrassed or shy in discussing their problems with the gynecologist. Many disorders at this age, unfortunately, are diagnosed late because of the woman's hesitation in meeting her gynaec. Symptoms like leakage of urine and difficult intercourse do have solutions if discussed. So please do feel free to ask any questions on this forum, and I'm ready to answer them. Back to you, Mr. Maheshwari.
Thank you very much. Thank you very much for a short and but clear presentation. I would request you to. So we have a few questions that have come in on my WhatsApp. Doctor, I face the problem of UTI very often. What do I need to ensure that I don't keep contracting it?
So, of course, it's a little difficult to answer this question without knowing the age of the person who has asked the question. So what is the average age group of the women listening to this webinar?
Not mentioned yet. Not mentioned, but it's about the age of 60.
All right. So the common cause of urinary tract infection in women who have achieved menopause is because of a very thinned out vagina because of lack of the hormone estrogen. So when women have repeated urinary tract infection at this age, we ask them to come for a pap smear. And if the pap smear is normal, we frequently prescribe hormonal estrogen creams for a period of 3 months to build up the vagina and prevent urinary tract infection. At the same time, we do a culture of the urine to try and identify the organism and give the appropriate antibiotics. We emphasize on the importance of drinking adequate water, which would be between 2 to 3 liters of water. And certain supplements like cranberry are known to reduce the incidence of UTIs. So I think that would answer this question.
Right. Doctor, the question which is there is, I'll just take the Q&A first. This is a question which is very general. How can I improve my gynecological health, and what are age-related gynecological problems?
So I think I mentioned that if we are looking at the age group of 60 years and above, the common problems are one, prolapse of the uterus. Now, prolapse of the uterus is because of weak ligaments which happen with age. So herein lies the importance of doing exercises, especially those exercises which strengthen the pelvic floor. They are called Kegel's exercises. And they are exercises which strengthen the muscles in the pelvis to prevent prolapse. So this is very important for the symptoms of prolapse which can come at this age. The second is, as I said, urinary problems. So that, as I have discussed before, that it is very important to go to your gynaec, find out whether you have a condition called atrophic vaginitis, in which the lining of the vagina is very thinned out, and there are solutions for the same. Then third is sexual dysfunction. So we have seen that many women, because of dryness of the vagina, find intercourse very painful, difficult, and they even if they have the desire, they do not indulge in sex because of this discomfort, and they often feel too shy to discuss with their gynaecs. So I think it's very important to discuss this, and there are a lot of lubricating creams which are available to solve this problem. And finally, of course, at this age, as it is with all the systems of the body, is the fear of missing out on a malignancy. And herein lies the importance of yearly gynaec checkups and screening tests as advised.
Right. Doctor, the question which is coming, are there any specific gynecological conditions or concerns that run in my family that I should be screened for?
Yes. So there is a triad of cancers of the breast, ovary, and the colon. So there are, so if a female member in the family has either a breast or an ovarian or a colonic cancer, then that woman should screen herself for these conditions. And in fact, the recommended screening is so most screening for gynec malignancies begins at 40 years of age. But these women should go for screening at a much earlier age, even 30 years of age. There are certain genes called BRCA genes. If positive in the family, then all the women of that family have to screen themselves for breast malignancy at that age. Similarly, ovarian cancer is also familial. So if someone in your family, your mother, grandmother, sister had cancer of the ovary, then it is imperative to do sonography once a year to look out for this malignancy. So definitely many genital cancers are familial and they run in families. So one has to be aware of that.
Doctor, another general question. Are there any specific dietary exercise or lifestyle recommendations to avoid gynecological disorders and basically ensure that overall health is there as I age?
So I think the recommendations are not specifically from the gynaec point of view. These are the general recommendations which we give to all women, where the importance of exercise and diet are stressed upon. Now, exercise is important because of two reasons. One, there is a reduction in bone density as you grow older, and the chances of developing osteoporosis are very high. And secondly, there is something called sarcopenia, which occurs as we age. That is, there's a reduction in the muscle mass. So as you grow older, you have to have a high protein intake, a high calcium intake, but a low carbohydrate intake. And you have to see to that micronutrients are also included in the diet. So this can be done in the form of nuts, seeds, sprouts. And for those who eat non-vegetarian food, fish is a very important source of these nutrients. So maintenance of body weight per se is obviously important, not only from the gynec perspective, but from general health perspective. Now, when we come to exercise, again, exercise is not only done for weight loss, it is done for muscle strengthening, for flexibility, and for preventing injuries due to instability and loss of balance. So these are general recommendations for everyone and not specific for just the gynec health.
Doctor, you have, in a sense, answered this question, but I'm still taking it from an anonymous attendee. Should I be concerned about pelvic floor weakness or bladder control issues? What preventive measures can I take to avoid?
So this is a very distressing symptom, which is very commonly seen. I would go as far as to say that almost 50% of women suffer from some urinary problem or the other because of weak pelvic floor. Now, when we say weak pelvic floor, it is the support which is given to the uterus, the bladder, and the rectum. So when the pelvic floor is weak, the uterus tends to descend and carries along with it the bladder in front and the rectum behind. And because of this, many women develop what is called as stress incontinence. Stress incontinence means that whenever they exert, be it a cough, a sneeze, or a laugh, or a shout, some amount of urine trickles out of the urethra, soiling their clothes. Now, initially, it may be a one-off thing, but if not corrected, many progress to the stage where they have to often wear diapers to move around normally. Now, it is really unfortunate that women do not take help for this on time, because there are many simple surgical methods available which tape the urethra and maintain the pressure in such a way that the urine does not escape. So these are, 15, 20-minute procedures, but the impact they have on your physical and mental well-being is tremendous. So I would really advise that any woman who has these symptoms of urine leaking out should definitely consult a gynec and take a solution for it, because otherwise it really becomes difficult for them, even if they have to move like in the car for 15, 20 minutes, or even if they have to visit a relative, they want to go for a movie, their social life just comes to a standstill because of these symptoms. And so this is very important. And of course, as I stressed, the importance of drinking adequate water. And even very important is that emptying the bladder at regular intervals. Women take pride in the fact that I can hold on to my urine for like 4 hours, 6 hours. I don't need to go to the washroom. But that's not correct. You have to train your bladder in a way that you empty it at the appropriate interval of time.
Right. Except that, in some of our cities, like Bangalore and Mumbai, traffic is so bad.
Yeah, and for women, it's worse. Unfortunately, the men in our country have no qualms in using the roadside. But yeah, that's true.
That's true. We have a question from an anonymous attendee, and those of you who would like to ask questions anonymously, please do that, and I will not take your names as well. In fact, for everyone. So this is a question from somebody who's 73 years old, and her question is it essential at this age to do a mammography as it is radiation?
So the newer mammography machines have a very, very low dose of radiation. And as I said, that mammography it is recommended to do it every 2 years till the age of 75. And the collective radiation is not detrimental. That has been very well calculated. And these are guidelines which have been given to us by our, official bodies. Now, but I know this, that many women fear this radiation. So then here we have two very important measures which you can take for early diagnosis of breast cancer. One is what we call as self-breast examination. So every woman should know the feel of her own breasts. And this self-breast examination, in fact, we advise monthly. So once a month, if you're getting your periods after your periods, or at any fixed time of the month, palpate. There are many online videos which teach you self-breast examination. You can palpate your breast to see if you can feel any lump, and then you have to look for any discharge from the nipples. So there's a very scientific way to feel the breast and make out. So what happens when you're doing this month after month? If there's any change in the feel or texture of the breast, you'll be surprised to know that many women themselves come to us saying that, suddenly since the last few days, this is what I'm feeling. And then they go for the next step, which is mammography. And second, so after self-breast examination, there's something called a clinical breast examination. Clinical breast examination means that you go at least once a year to your doctor and let the doctor examine you. Then there's a third, which is called screening, which is called sonomammography. So sonomammography is a sonography of the breast in which lumps can be picked up. So though the gold standard is mammography, these are other ways in which you can screen your breast for any tumors.
Right. She has another question. I have a B12 deficiency. How can I increase my B12 by diet, and what tablets will help? I guess it's not a specific question.
It's okay. Tablets, though, obviously there are hundreds and thousands of over-the-counter medications for B12. But, for vegetarians, B12 is mainly in seeds and sprouts. But there's a limit to how much you can take of that. So it is very, very difficult to correct B12 deficiency only with diet. Same way for B6, that is folates, that is all dark green vegetables. But many times our Indian method of cooking and overcooking tend to destroy these vitamins before they even enter the body. Then many gut conditions like, having IBS, taking antacids, poor digestion, they all reduce the absorption of these medicines from the body. So most often at this age, we have to take B6, B12 supplements, but you should check your levels in the blood. There are blood tests available to see whether you really have a B12 deficiency. Many women tend to keep taking B12 till they get what is called an overdose or hypervitaminosis, which is also not welcome. So best is to, when you go for your yearly annual checkup, do a blood test for your vitamin D3 levels, your vitamin B12 levels, and then get it corrected if it is low. Now, coming to another vitamin, that is vitamin D3. Everyone knows this is the sunshine vitamin. We get it when we expose the upper part of our body to the early morning sun. Now again, the same thing with cloudy weather, with not going out early in the morning, with going out in the sun after the UV rays have become very strong. We don't get enough of vitamin D3 naturally, though it is possible to get it. So that is another vitamin which we have to correct, because it is very important for various metabolic activities in the body, along with being very important for our bones. So there are certain vitamin supplements, same way for calcium. I'll just come to calcium quickly because I'm sure many women are interested in knowing about calcium. So in 60 years and above or post-menopausal, the requirement of calcium is around 1200 milligrams a day. And we can get calcium from our diet. All dairy products have calcium. Fruits like banana has calcium. Seeds have calcium. Sesame seeds have calcium. But again, the same thing, that 1200 milligrams is a large amount of calcium, which the body needs to prevent breakage, weakness of the bones. So calcium is another supplement which is strongly recommended to all women in this age group.
Right, thank you. Doctor, we have a question that said that, Doctor, you mentioned about genetic testing, genetic tests and BRCA1, etc. How does one get it done, and are these very expensive?
So these are blood tests which all the major labs of our city are doing. I'm not exactly very sure about the expense. I think I'll have to look it up and tell you. But I can definitely tell you that it is worth the expense. So, it doesn't have to be done for everyone. So if there's a family history of a female relative who has got breast cancer at a very early age. See, breast cancer, which may come at the age of 55, 60, 65, 70, is like any other malignancy in the body. But those with the BRCA gene typically develop breast cancer around 40 or before 40 years of age. So those are the relatives for whom this test has to be done. Not that if you have a 70-year-old grandmother who has got breast cancer, you don't have to run and do your genetic testing. You understand? So it is typically for those female relatives who have developed breast cancer at an age which is younger than that of the general population.
Doctor, this is a question which is not exactly of a senior citizen, though it's perhaps being asked by a senior citizen. My daughter is 27 years old. Her gynaec told her that she is having PCOD. Another one said that she does not have it. How does one detect PCOD and ensure it's eliminated for good?
Okay, okay. So we are digressing. Never mind. No, so PCOD is a hormonal imbalance seen from a young age, and the diagnosis of PCOD is one by symptoms. So if a girl has got very irregular periods, she's suffering from obesity, acne, excess hair growth. Two, it is a sonographic diagnosis also, where there are typically there are a lot of follicles seen in the ovaries. And three, it is also possible to diagnose it with certain hormonal blood tests. But one doctor saying yes and one doctor saying no, these are all biased opinions. You have to go by the reports. So I think, I don't know if any of these tests have been done for her. And there is, it's a spectrum from mild PCOD to severe PCOD. And most often in young girls, the first line of treatment is lifestyle management, which again comes back to diet, exercise, and coming to your optimal BMI, that is weight.
Doctor, we have two hormone-related questions. First is, I have been told by my GP that I've had hormonal changes post-menopause, and which could impact my gynecological health. Is hormone replacement therapy advisable in my case?
So it is menopause and post-menopause is obviously hormonal imbalance. You go into menopause because your estrogen hormone, your body has stopped producing estrogen hormone. So basically, menopause is a state of estrogen deficiency. So when we say that a person has gone into the menopause or the postmenopausal state, what we mean is that no longer does she have the estrogen hormone in her body. So typically it is like if a person has got a thyroid deficiency. So if you have a thyroid deficiency, then your doctor will just prescribe you the thyroid hormone and say that you just take it lifelong. Now, hormone replacement therapy there is available, but it is not so as simple as popping a thyroid tablet in the morning, because the hormones which are used for hormone replacement therapy also have their own side effects of uterine malignancy, breast malignancy, if not monitored properly. So yes, we do offer HRT to women who want HRT. HRT is hormone replacement therapy. If who want HRT or who are suffering from certain distressing conditions like weak bones, or as I explained to you, dryness of the vagina. Sometimes, and this estrogen hormone is very important for cardiovascular health, to prevent dementia. But you can take it only when prescribed by your gynac, with the correct dose, duration, and very correct monitoring. So women who are on HRT have to regularly go for all the screening tests to rule out various genital malignancies in the body. Now, there are certain drugs which mimic the hormone. So they are called designer estrogens. So they mimic the good effects of the hormones without the side effects of the hormones. So definitely you can discuss with your gynecologist about these drugs, whether you need to take them and how to take them. But definitely HRT is an option, provided it is used with care and caution. So you need your gynac to prescribe it to you.
Doctor, this is the second question about hormones. There are quite a few new variants of milk that are coming, which are hormone-free, etc. Is that something that one should avoid, given the fact that one is
the only hormones which this milk contains is what we call as oxytocin. So basically, the milk which is produced by the cows is actually the milk which the cow has produced to breastfeed the calf. So to stimulate that milk production, the cow is injected with this hormone called oxytocin. And so the milk contains large amounts of oxytocin, which is obviously not good for us in the long run. But how to, get over this, and which are the companies which give us this oxytocin-free milk, I don't know. Or maybe you have to just go vegan and forget about milk completely. That is the other alternative.
Thank you very much, Doctor, for being here. We have fewer questions today, but I guess the topic is such that
yes.
People may not really come out to the open.
Yeah. But so, I just want to end by saying this, that just keep going to your gynac. Don't, because these are organs of our body which are literally hidden from view, and they do not produce any side effects till it is too late. And gynecology is one field where the screening tests which we are doing have produced a radical difference, have made a radical difference in cancer statistics. And these screening programs are so successful that the cancer rates in the countries which strictly follow these screening programs has been significantly lower than those countries which do not have such strong screening programs. So do take advantage of these screening tests. And the second, what I want to leave you all with is that all the young girls in the family have to be given the vaccine, which is a vaccine against a human papilloma virus, what we call HPV vaccine. This vaccine is advocated in girls from the age 9 years onwards, because it is a very, very important tool in reducing the incidence of cervical cancer. So a vaccine which you have taken in your childhood or in your adolescence is going to prevent you from getting cervical cancer when you are very old. And that's such a great breakthrough. And I would request everyone to take advantage of this knowledge and see to it that all the young girls in their family are vaccinated with this HPV vaccine.
And this is to the age of 26, is it, or even older?
So now it is best taken when you are very young. And however, the recommendation is that you can take it up to 40 years of age. So even if you have missed the bus, because many of us, when we were young, it was not available, a vaccine. And now initially the vaccine was expensive, but now Serum Institute of India has again come out with a little Indian cheaper version. So it is very doable. For young girls below 14 years, there are just 2 doses to be taken within 6 months. After 14 years of age, you have to take 3 doses within 6 months. And I would strongly recommend that all the girls take it.
And there are no after effects.
There are no harmful effects of the vaccine so far.
Well, thank you very much. I think these are, very important words of advice. As always, all of you here, the edited video of this session will be available on the Seniors Today website on Monday evening, as well as takeaways from the webinar. So please watch it. You can look at the presentation once again and go through all the Q&A that has come in over here and enrich yourself. Of course, Dr. Ambegaokar is available at the Nanavati Max Hospital in Mumbai. And I think there is a teleconsult facility that Nanavati Max also facilitates. So you can always reach out to her. Those of you who want a second opinion from outside of the city, or just want to be very sure, it's always good to speak to a senior doctor like Dr. Ambegaokar. Thank you very much for being here. Thank you very much to the Nanavati team for facilitating this. And we will be back once again next Saturday for another session of Health Live at Seniors Today. In all probability, as we speak, we have Dr. Percy Chibber, who's going to be coming in, and he's going to be speaking about incontinence, an issue that you dwelt on, but we don't have 100% confirmation yet. So please do await the announcement. And once again, if you would like to attend our health webinars, you can also pre-register, that you don't miss out on any update. And as I've mentioned in the past, we have something called the Evergreen Club, so you can take part in various programs. There are entertainment, there are meditation sessions, etc. And the Evergreen Club app is free of cost. The subscription to Seniors Today is again free of cost. No conditions apply, and the magazine as well is available. So please go ahead and access the SeniorsToday.in website. You can access all of this. And once again, thank you very much to Dr. Rekha Ambegaokar for being here.
Thank you. Thank you. Good day.
Subscribe now and press the bell icon. Never miss an update.